people have a lot because of their lifestyle. A lot of lifestyle ailments come in because like joint pains or body aches and all that, and people just pop in NSAIDs or painkillers or anti-inflammatories, as you call them.
Yeah.
Many times they also get addicted to these anti-inflammatories. So how does excessive use of NSAIDs or what so-called anti-inflammatory medications affect the kidneys, doctor?
So I will divide this into two parts. One is analgesics and another is NSAIDs. So somebody who has a chronic joint pains or backache, they used to take a lot of analgesic drugs. Now all analgesic drugs will have either caffeine or codeine, which is addictive. So they keep on popping it up. And as a painkiller, they have aspirin plus phenacetin or acetaminophen or paracetamol. Now, caffeine and codeine will cause you addiction, so you tend to take it every day. Aspirin in that analgesic drug will cause glutathione deficiency in the renal papilla. And when it causes that glutathione deficiency in renal papilla, and if there is another phenacetin or acetaminophen or paracetamol combined in that drug, then it will cause papillary necrosis of the kidney and then will cause chronic interstitial nephritis, and that's how it will damage the kidney on a long-term basis. And if this patient consumes a lot of analgesics for 2 years, 3 years, 5 years, over a period of time, you will see that on sonography, their kidneys have become small, irregular, and there are calcifications in the medullary region. So this is classical presentation of analgesic nephropathy. Now you opened up a can of NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs, commonly known as Voveran, Combiflam, piroxicam, COX-2 inhibitors. Now, these NSAIDs have a different mechanism of action, and they cause kidney damage. It will cause vasoconstriction of the renal vessels. It's not the main renal vessel which becomes constricted, but the small capillaries which supply blood to the kidney, they become vasoconstricted. Then there is worsening of hypertension because of NSAIDs. Then there is electrolyte imbalance, like they can develop high potassium level in the blood, they can develop low sodium levels in the blood, they can develop swelling, fluid overload, and they very rarely, some NSAIDs, if you use chronically, they are also attributed to renal cancers also. Now, NSAIDs per se, we, in our nephrological terms, we say that it can cause acute tubular necrosis, acute interstitial nephritis, it can cause MPGN, it can cause nephrotic syndrome, it can cause membranous nephropathy. So presentation in a different form, but ultimately the affection is of the kidney. And a patient who is elderly, diabetic with hypertension, and you have taken unsuspecting NSAIDs for 5 to 10 days, the doctor has prescribed you for 5 days for your joint pain or backache, and you continue to take it for long term, then you are surely inviting kidney failure, and it will be an irreversible kidney damage to the patient.
Analgesics are painkillers and NSAIDs are anti-inflammatory
Inflammatory
medications.
drugs, yes.
And these two drugs and these two medications, which are prescription medications, but also available over the counter,
Over
hence
the
people are
counter,
more
yes.
prone to popping them without considering the implications and the consequences. And you have put it forth very beautifully that it can cause, basically what they do is inflammation first of the kidney,
Yeah.
tissues of the kidney, which result in various ailments related to the kidneys, and that ultimately this, it is toxic. They are all toxic to the kidneys, and they ultimately result in failure. So those who are addicted to these anti-inflammatory medications and also painkillers need to be very, very aware that even like if they have comorbidities like diabetes, etc., they can come down with kidney failure even in a span of 10 days time.